हेलो गुड मॉर्निंग। मैं से डॉक्टर आर्यन और आज हम डिस्कस करेंगे मेडिसिन के इम्पॉर्टेंट क्वेश्चन। अ 65-year old present to the emergency department with a complaint of an episode of chest pain and sweating one day back. He lives in a remote village and present late to the hospital due to the transport related issue. He has had a history of diabetes, hypertension 10 years. On examination the pulse is 86 and blood pressure 150/80. ECG shows pathological cubics. Here are the important points. In anterior chest list, cardiac troponins are elevated. Which of the following drug is not given in the management? Aspirin, statin, thrombolytic therapy, and morphine. Here the best answer is the thrombolytic therapy. Why? Because the above case in a consistent with the late presentation of myocardial infarction. A history of here acute chest discomfort in a patient with typical cardiovascular risk factor क्या है? हाइपरटेंशन, डायबिटीज, एज एंड लोकलाइज एंटीरियर लीड्स. ECG shows Q waves with elevated cardiac enzyme indicated recent myocardial infarction. If the patient has presented late to the hospital after 24 hours, this profound impact the management of the disease. And the basic management of acute coronary syndrome include aspirin or clopidogrel, beta blocker, statin, and morphine are nitrates for pain relief. In addition, patient with STEMI who seek medical attention within 12 hours of symptoms should be treated with reperfusion therapy. Reperfusion therapy include primary percutaneous intervention or intravenous fibrinolytic therapy. Next question. Which of the following side effect is common with protease inhibitor? Anemia, hepatotoxicity, lipodystrophy, and peripheral neuropathy. Lipodystrophy is the best answer because the lipodystrophy is a common side effect with the use of protease inhibitor. And anemia में क्या होता है? Seen with NRTI, Zidovudine example, and hepatotoxicity seen with NNRTI, protease and protease inhibitor, and peripheral neuropathy seen with NRTI. Next question. A 30-year-old patient came to the clinic with complaint of breathlessness on exertion, fatigue with fever for 3 days. On examination by the physician, the patient had a chunky gelatinous sputum flux. फीवर है 3 days से, और जब एग्जामिनेशन किया फिजिशियन ने तो चंकी जिलेटिनस स्पुटम प्लग्स. डॉक्टर हैज राइट चेस्ट एक्सरे HRCT showed bat wing appearance, lung infiltrate, and a crazy pavement pattern respectively. Bronchoalveolar lavage was taken which showed the presence of PAS positive lipoproteinous material. Which of the following is the diagnosis of the condition? Pulmonary alveolar proteinosis, the best answer because the clinical scenario क्या? Pulmonary alveolar proteinosis. It has characteristics of breathlessness on exertion, fatigue, fever, chunky gelatinous sputum flux. Chest X-ray shows bat wing appearance of lung infiltrates and a crazy pavement pattern respectively. And PFT, pulmonary function test, and a restrictive pattern, FEV1 or 1 FAC is a normal or increased. The investigation of choice is BAL, bronchoalveolar lavage, presence of PAS positive lipoproteinous material. Next question. In a patient present with chronic dyspnea and a long history of smoking, a physical examination revealed paradoxical inward movement of the ribcage during inspiration. Which of the following option best describe the characteristic found in a Hoover sign commonly observed in a patient with chronic bronchitis? Paradoxical elevation of the diaphragm during inspiration, paradoxical expansion of the chest wall during expiration, paradoxical inward movement of the ribcage during inspiration. Then the best answer because the Hoover sign is a characteristic finding observed in patient with emphysema. Emphysema, it refers the paradoxical inward movement. Paradoxical क्या करता है, कौन सा मूवमेंट, इनवर्ड मूवमेंट ऑफ द लोअर rib cage during the inspiration. Instead of the expected outward expansion, this phenomenon occurs due to the loss of elastic recoil in emphysematous lungs, leading to decreased lung volume and ineffective chest wall expansion during inspiration. Next question. In a sleep study, a patient is observed to have a decrease in airflow by more than 30%. For more than 30% for more than 10 seconds, accompanied by 3% decrease in arterial oxygen saturation, SaO2, and cortical aerosol. What is the term you define the respiratory event? Hypopnea. Because the hypopnea is defined as a decrease in airflow by more than 30% for the more than 10 seconds, accompanied by 3% decrease in where arterial oxygen saturation and cortical aerosol. This respiratory event represent a partial reduction in airflow, leading to disruption in normal breathing pattern during a sleep. Apnea refers to the complete cessation. Apnea क्या कहता है? During the complete cessation of airflow for at least 10 seconds during sleep. Bradypnea is a term typically used to describe an abnormally slow respiratory rate, but it is not especially related to the object clinical. And tachypnea refer to the abnormally also rapid respiratory rate. So अगर हम हाइपोपेनिया बोलेंगे तो क्या इम्पोर्टेंट पॉइंट है? मोर देन 30% डिक्रीज्ड इन एयर फ्लो फॉर मोर देन 10 सेकेंड. तो ये क्या है? हाइपोपेनिया. हाइपोपेनिया फिर से करेंगे. मोर देन 30% डिक्रीज इन एयर फ्लो फॉर मोर देन 10 सेकेंड. तो ये क्या है? हाइपोपेनिया. हाइपोपेनिया एसोसिएटेड विद द 3% डिक्रीज इन SaO2. एसोसिएटेड क्या है? 3% डिक्रीज इन SaO2 एंड कॉर्टिकल एरोसोल. कॉर्टिकल क्या है? एरोसोल. हाइपोपेनिया कैसे बोलेंगे? मोर देन 30% डिक्रीज इन एयर फ्लो फॉर मोर देन 10 सेकेंड. Remember this one, important. And associated with a 3% decrease in SaO2 and cortical aerosol. So today that's all. Thank you and keep revising.